Hello, everybody. Recently, I've had a few patients who've come into the office and have been symptomatic from the weather change outside with a runny nose or a stuffy nose or sounding nasally. And so I wanted to make a video and talk to you about what may be going on in your body and what you can do to combat this. Now, when your toxin load in your body is high, your inflammation levels will also be high in your body, which makes it hard for us to deal with the things that we come in contact naturally day to day. Now, there's other ways, of course, that inflammation levels will be high in the body besides toxin load from, nutritional choices with sugar and carbs, being overweight. But your toxin load is going to play a pretty key part into the inflammatory levels in your body. Now, we are constantly exposed to toxins, through air, water, food, prescription medications, alcohol, recreational drugs, cleaning products, personal hygiene products, and so forth. And so with that much exposure, it's impossible for our liver to keep up. And in fact, I read an article not long ago that said that the average person today is exposed to more toxins in 2 days than a person who lived 100 years ago was ever exposed to in their lifetime. So with that being the case, it's just impossible for our liver to keep up, and we got to help it out. Now, there are plenty of ways to detox, and we have several options for you here at the office. But one of the most effective ways that I've seen to detox, we have access to here is a two-part detox system, where you take 2 pills in the morning, a half an hour before you eat, 2 pills at night, an hour before you go to bed. And these pills, they spin the toxins in the cell, and then they bind them so that you will safely excrete them the next day. It's not a flush where you need to do it on a day off or anything. It's a 30-day long process. But usually I've seen with myself, especially within the first 3 days of having an issue, starts to get better. In fact, I most commonly get my problems in the spring when I want to start golfing again. And commonly how it's happened for me in the past is I've had to take two towels with me to golf, one for the clubs and one for my nose. And so I would go to set up on the ball and I sneeze 3 times. And I have to go get my towel and blow my nose, and then I start getting a little itch in my nose, and then I start to need to have to sneeze again. And this is all during when I'm trying to concentrate, a game I'm trying to concentrate in, right? And so when that starts to happen, it lets me know how toxic I am or how high my toxin levels have gotten. Because of how that goes for me. Now, initially, if you're someone who gets these symptoms, initially, you may need to do a 2 to 3 month detox regimen in order to get your toxin level down low enough to where you can stop being symptomatic. But additionally, once we've gotten your toxin level down, you need to maintain it because, again, we're exposed to these things day in and day out, where, once you got it down, usually 1 or 2 times a year is a maintenance dose on that. So, like I said, we do have different options here in terms of detoxification here in the office. If this is something that you are dealing with, please come in. Let's talk about this and see what we can do, and get you getting back on the road to health so that you can have your best year yet. So, with that being said, guys, that's all I have for you tonight. Have a great day. Take care. God bless.